Imagine living in a world where the narratives surrounding addiction are fundamentally misunderstood. This is not hypothetical, it is the world we currently inhabit. For years, society has framed addiction as a moral failing, an issue of weak will or poor character. However, recent research and narratives suggest a deeper and more compassionate understanding. Let us delve into the complexities of addiction and unravel misconceptions that have pervaded our understanding. Traditional views have often painted addiction as a consequence of the chemical hooks in drugs, rendering the individual helpless against the lure of substances. Yet, studies from the 1970s, such as Bruce Alexander's Rat Park experiment, offer compelling insights that challenge this view. Alexander demonstrated that rats housed in a stimulating environment with social interactions were far less likely to succumb to drug addiction compared to isolated rats. This transformative finding emphasizes the role of environment and social conditions over the mere presence of a drug. It is crucial to explore the human element. Often, addiction stems from unmet needs and a lack of connection. Renowned journalist Johann Hari, in his TED Talk, highlighted that the opposite of addiction is not sobriety, it is connection. This statement underscores a paradigm shift, suggesting that rebuilding relationships and nurturing community ties can play a pivotal role in recovery. Furthermore, countries like Portugal have set a precedent by decriminalizing drugs and redirecting funds into rehabilitation and social reintegration programs. This approach not only reduced overdose rates and prevalence of addiction, but more importantly, it dismantled stigma, allowing individuals to seek help without fear of judgment or incarceration. It illustrates that understanding addiction as a public health issue, rather than a criminal one, fosters more humane and effective solutions. Discussing underlying mental health issues is equally important. Many individuals battling addiction also suffer from untreated mental health disorders, creating a vicious cycle. Addressing mental health head-on opens therapeutic avenues that can alleviate the burden of addiction. The narrative must shift towards empathy and understanding, recognizing that people with addictions are often trapped not by choice but by circumstance. Their stories are not merely about succumbing to substances, but about struggles for meaning, belonging, and healing. As we conclude, remember that changing the addiction narrative requires societal, individual, and institutional commitment. We must dismantle outdated perceptions and embrace approaches rooted in scientific research and compassion. Each person's journey is unique, and by broadening our understanding, we can offer more inclusive and effective support systems. Together, let us pave a new path forward where the focus is on healing and reconnection.